Okay, happy St. Patrick's Day, everyone. Thank you for joining us. We've got a lot to be thankful for on this St. Patrick's Day, yet a long ways to go until we see the end of this crisis that has now surpassed a year in length. And let me just reflect upon the fact that it was a year ago, on March 17th, that really marks the anniversary of our stay-at-home order due to COVID-19. And that was when, as you remember, the 6 counties got together. And at that point in time, we had 258 cases, combined cases in the 6 counties. And as you look today, we have just about approaching 40,000 cases and well over 500 deaths, which is tragic. We do have, and Miles, why don't you cue it up? We have put together a slideshow to commemorate this sober milestone, and the JIC has really done a nice job of putting this together to really just illustrate what we've gone through over the last year. We'll send the link out to you. We'll just go through a few pictures here, just really blast through a few pictures quickly. A lot of you will remember these times in the start of testing and a lot of the milestones we hit together. The JIC has done a nice job of really going through and trying to commemorate all of the different segments of this crisis that we went through, and then also certainly the crisis that we had within the crisis, which we planned for. So with that, we'll send that link out, and we'll hopefully you can get an opportunity to flip through it. I do want to announce a change in strategy in regard to the vaccine rollout. We have thought long and hard about this, and we have spoken to our partners at Blue Shield, and we have information that we believe is correct, in that we're going to be based with the status quo as far as the amount of vaccine that we'll receive over the next 2 to 3 weeks. For example, a couple of weeks ago, we received 22,000 vaccines, doses of the vaccine, and now we were just down to about 18,700 this week, most of those being second doses, which doesn't allow us much room for first doses. So by the time we give some of those out to our partners who do such a great job, like Ravenswood and Geller, NIMS, and other partners throughout the county, we had about 2,200 doses left. We did one mass vaccination this week, or we will do one mass vaccination this week. So we're going to change the strategy. We're not going to do first dose mass vaccination in the drive-through manner for the foreseeable future until those doses increase. And we're going to decompress those centers and spread them out into vulnerable communities, in communities which have seen high instances of COVID-19 throughout the county. So we will do smaller local community events in these various locations throughout the county, and I could say the county will be well represented in the cities will be well represented in these smaller community events. This is really to augment what we've already been doing, and we have been doing for some time now on these smaller community events. We're going to push more vaccine to those, and we hope to have 6 or 7 of those community events up on a regular basis throughout the week. And we'll see how those are deployed, whether it's 1 day, 2 day, 3 days, or 4-day events in these various communities. But we'll have multiple community events going on at the same time throughout the county, in various parts of the county. And we think that this will achieve several goals. First and foremost, getting vaccine into the vulnerable communities that don't maybe have an opportunity to get to these mass vaccination sites. Secondarily, it will create a better pipeline when doses do start flowing, so we can do both concurrent, where we have the mass vaccination sites going on at the event center and SFO and potentially other sites in the South, while we're also doing the community-based, hard to reach communities in a more intimate way, kind of a block by block, door by door type of way that will be out there canvassing and getting people to those locations that are qualified to get the vaccination. And thirdly, we are in jeopardy of losing some of our vendors who see more opportunity in other locations that are receiving more vaccination because we're not in that 40% equity category. We didn't get, as you all know, any vaccine, additional vaccine to deal with our vulnerable communities. So we will be employing this strategy starting next week, hopefully, as we now really work with our community-based partners and, more importantly, the cities to organize these community-based, more intimate vaccination locations that people can walk to or get to very easily and will not have to travel a very long way to get there. Obviously, we won't be able to have the numbers that we do in one of the mass vac sites where we're doing 3,000 to 5,000 a day, but we feel that these very targeted events will get to the communities that are vulnerable and in need of vaccination, and will also help us really get through the next tiers by targeting those areas where we have seen high instances of COVID-19. If we take those out and stop the spread there, it'll even allow us to potentially progress faster in our tiers and move to yellow sooner rather than later. So that is the plan. Looking at the numbers as we always do, I just want to point out the hospitalizations look great. We're down to 18. We haven't been down this far in a long time. So any case is tragic, but at least we're not seeing those outrageous numbers that we did in the past. And this has obviously freed up the ICU beds and the acute care beds to something that is more manageable. And we hope that the trend continues. A testing update at this 1 year mark of the first stay at home order. San Mateo County continues to be #1 in testing in the state. We do go back and forth with Yolo County, who is utilizing the UC Davis students in a massive way to get their testing numbers. But this has really benefited us. And we want to remind residents of this county that there is still a need to get tested. And there's really 3 reasons to get tested. One, residents need to know, of course, if they're infected and if they have COVID-19, so they can safeguard themselves away from their family and friends, and that we can do contact tracing and warn others that we're in their circle. So that's still very important in stopping the spread of the virus. Testing also lets us know whether there's been a virus mutation in the community, and that is very important for us to know. And of course, the third reason is testing continues to be one of the key metrics used by the state's blueprint for a safer economy. And that's one of the things that has really allowed us to move through the tiers and to stay out of the lower tiers that some are still in and stuck in. So for the latest information on testing options, please visit our testing page at www.smcgov.org/testing. We have testing all over the county every day of the week practically, and that has really helped us out. But it's really easy to reach and easy to make appointments for now. In regard to the blueprint for a safer economy, we all know that we are in the less restrictive orange tier, that we're the first county of our size to be in that tier, which has opened up a multitude of different opportunities for family entertainment to reopen, for theaters to have more, for restaurants to have more, for no capacity restrictions in malls and shopping, but certainly still safeguards need to be implemented in those locations. So we are encouraged by that, but we want to really send a message of caution. that we have a long ways to go. This is not the time to say that we've hit a home run, but rather a time to say this is just another base along the path to getting to a home run. And we're taking it a base at a time. We need to continue to use caution and have people continue to wear their masks, socially distance, wash their hands, and do all the right things and make sure that businesses adhere to that philosophy. And just a shout out to the businesses, because we know that they have been suffering greatly throughout this pandemic, but I don't think we certainly could have reached the level of Orange without their cooperation. And some that have been shut down for a long time, and others have just been hanging on with just a small amount of business coming to their location. So they have done the right thing. They're most of the ones that we have spoken to, with very little exception, are really concerned about the health and safety of those who come to their business and have done the right thing. So we're just very thankful for their cooperation, as well as the residents of this county who have adhered to the precautions of health. And just a shout out to Health for the great job that they have done throughout this and leading the way to try to get us through these tiers in a safe way. So we will continue to walk down that path of caution while being cautiously optimistic of moving on to the next tier in the upcoming weeks, and see more people get back to work and more locations open as we someday reach the new normal, whatever that might be. Vaccine allocation, we talked a little bit about that is not going to, the numbers of vaccinations that we're going to be able to get out on a first term basis does not look like it'll increase for the next several weeks, and that's why we've shifted that strategy. In the meantime, our partners at Sutter and Kaiser and Dignity and everyone else, the HMC, will continue to vaccinate accordingly to the amount of doses that they get, and they will be under the same mandate that we are. And our commitment is that even though we're going to this other model, we will get through all those doses in 1 week, so that we can show that we are getting those shots in arms, and then hopefully be replenished the following week with more. So we will wait to see that. We still don't know what our allocation is for next week. And again, it makes it hard to plan for the following week when you don't know what your allocation is, but we are putting the pieces of the puzzle together as we speak. On to the third-party administrator. Over the past several weeks, CSAC and the County Councils Association worked with the administration to move away from a contract between Blue Shield and the counties and toward a much preferred alternative of a MOU between counties in the state of California. At some point, the county will sign the MOU. It continues to be tweaked. I think there was a couple more changes last night to it. And we will continue to evaluate that and work with our partners at CSAC and the County Councils Association to make sure that the needs of the counties are met in this MOU. So the county's primarily interested in getting shots into as many arms as we can, as you all know. And signing the MOU recognizes the county's critical role in coordinating the vaccine effort and provides the mechanisms to work with the state's chosen third party, Blue Shield, to accomplish that goal. And we've had open conversations with Blue Shield. They've been accessible to us, and we will continue to work with them. So the MOU was negotiated by a representative group of the counties that really tried to ensure the county's community knowledge and partnerships can still be leveraged in the distribution of the vaccine to county residents. And it's really the feeling that we have a mechanism in place that has been working, where we vaccinated about a third. We're actually about just out a third right now, about 33% of the county residents through this mechanism with our partners. And our greatest concern is we don't want that interrupted in any way. So the MOU is designed to further ensure that the county continues to have direct line to the state when it comes to vaccine distribution, rather than routing any concerns through Blue Shield, and that Blue Shield consults with the county prior to making allocations, so the county's community knowledge and equity concerns may be considered. And truly, that is one of our great concerns, is equity in this county. And as I mentioned before, that is in part why we are shifting our strategy. We didn't get 40% more of doses to deal with equity in this county, so we will do it on our own with our own allocation to ensure that we address the needs of those most vulnerable. So the county continues and remains committed to working with Blue Shield to ensure the equitable and uninterrupted distribution of the vaccine. We, quite frankly, look forward to the day when we are inundated with doses, because we will then be doing the mass vaccinations and the community vaccinations while working with our partners. So as I mentioned before, the doses have decreased from 22,160 to 18,790 the past week. And that indicates, and those are mostly going to be utilized for second doses. We have vaccinated 206,866 individuals, have received just over 300,000 doses as of 3/15. So you can do the math and see how many second doses people are complete with a cycle. And that represents about 32% of the population 16 and over. The good news, though, and this is truly great news, this also includes 96,000 residents aged 65 and older, and or 73.9% of the county's 65 and older population. And it also includes just under, I think it's at 80% now, 80% of the county's 75 and over population. So at Lucky and Safeway pharmacies, we've distributed vaccine to Lucky's and Safeway pharmacies to provide other options for vaccination for the 65 and older population, and for the worker groups in education, childcare, food, and agriculture. And these pharmacies will vaccinate their own workers, which is good news. And Safeway Pharmacy opened 900 protected appointments at their brick and mortar sites for HPSM 65 and above. And that's great to see that we have a dedicated location to send those folks. And given challenges with outreach, 600 of these will be opened up, currently eligible populations for non-HPSM members. And it's still a challenge to get out there and really find those HPSM members who have not been vaccinated or who want to be vaccinated, but we will continue to try. And that's why our outreach efforts on the county call center are so important. The federal pharmacy partnership, we now have 8 brick and mortar pharmacies in Essex County directly receiving federal vaccine, the CVS and Rite Aid. Other counties also have Walgreens and Safeway sites, but these are not yet available in San Mateo County through the federal partnership. In the current vaccination events and outreach, again, we're trying some of those smaller ones, and we look to do that this week in East Palo Alto with partnership with Belhaven. Has just been doing a great job in partnership with us down there for these smaller events. We're going to do one in South San Francisco, Belhaven, and North Fair Oaks. Again, we look to sustain these in these neighborhoods and others on a more regular basis as we shift our strategy. And the county is also deploying the same mobile vaccine model that was used to vaccinate farm workers at farm sites, and they'll be heading out to our homeless shelters to vaccinate our homeless in the near future that are at the shelters, hotels, and through street medicine on the streets. Just to give you an idea of county call center calls, we have, in partnership with the CGI, made 11,500 outbound calls, taken 7,400 inbound calls, and set up over 6,000 appointments. And the business engagement, our folks still remain busy out there. We want to make sure that we don't let our guard down, and that we'll still be monitoring business to make sure that they all do the right thing and don't get too excited about this move to orange. But we just want to make sure that we're continuing to monitor them and work with our business community. Okay, a couple questions today. First one, where's the county at with making a decision to join the Blue Shield Partnership? Talked a little bit about that. It's really the partnership with an MOU with the state. And we are still monitoring that and making sure that we review any changes to that before signing on. Interesting enough, those who have already signed on will still reap the benefit of those latest changes, which I think came through last night, actually. So they will still be able to enjoy those changes. And with the current supply constraints, is the county on track to vaccinate all residents ages 16 and older by the end of May? You know, that really was aspirational by the part of the Biden administration. But the answer is yes, and only yes, if we get the doses necessary. We can scale very quickly. And you know, we will, if we get those doses, stretch this staff even more. And they've been doing a tremendous job and have stressed themselves and stretched themselves so far, but we will bring in more resources, whatever it takes. We are in a race against time, and you know, every single death that is caused by COVID-19 is tragic. And I look forward to the day when we see that last death related to COVID-19. So we will get those vaccines as we get them out, as quickly as we get them, by whatever means we can, whether it's mass vaccination or the community-based organizational events that we will do in the near future and have been doing it in the past. So with that, Miles, why don't we go ahead and open it up to any questions, unless Sarita has anything to add to those two questions.
No, I think you covered it, Mike.
Great. So I saw Sarah's hand up. So Sarah.
Hi, thanks so much. I know on the county's vaccine website, it says that some metrics for smaller populated areas, such as Pescadero, that those percentages aren't accurate. You know, what's a better way to get an accurate reading of people vaccinated in small areas? And you know, do you have any more accurate thoughts on how many people in Colma or in Pescadero actually have the vaccine?
Regina?
Hi, Sarah. That data on our dashboard has the best denominator we have, which is from the last census, and we won't have full results of the most recent census until that's completed. And there were some delays in that at the federal level. So we gauged vaccine reach by that data as well as demand in doing these locally targeted efforts. So we have an effort out in the South Coast every week, and we're looking at, you know, how many doses are we taking out there? How many people can be lined up to vaccinate? And we're monitoring that, you know, with our partners that are helping with the outreach and signing up. Colma also is a small denominator community. So similarly, we don't really have a better data way to track that, but we're certainly using our on the ground experience to adjust every week.
Thank you. And overall, I see the data says that in our most vulnerable communities, we have about 26% uptake of the vaccine as opposed to 1/3 or 33% overall. You know, in doing these small localized events, how else are we trying to up that number in our lowest HPI quartile areas?
Yeah, some of that, I think, Sarah, is a factor of the demographics and the tier system that we've been stuck with. And you know, it's a complicated type of thing. We, you know, for example, let's take East Palo Alto. It may have a younger city population that really hasn't fallen into the tier system yet, where Atherton maybe has an older population, or more medical people that fall into the tier system. So we are stuck within a tier system that we're trying to work through. We hope now, you know, that more you know, industries are open up. It's kind of a blessing and a curse, because we don't have the vaccine to necessary to address all the needs out there of those communities that are now eligible, but it will open up more of those eligible in some of the vulnerable communities. And that's in part why we're now able to go in and really work with these communities in a more meaningful way. And you can see our efforts in a lot of those areas in dealing with the vaccination of the older population, 65 and above and 75 and above, has really paid off.
Just a couple things I would add, Sarah, to what Mike relayed. We've really needed to follow the eligibility guidelines because the supply has been constrained. And within each eligibility group, we've prioritized, the most exposed and the most vulnerable. And that could be by geography, that could be by the type of living situation, that could be by other characteristics that community partners and we know on the ground. And if you look at our equity dashboard, we do have a gap where we've reached 33% of the county as a whole. It's 27% in the lowest HPI communities, but among the lowest HPI communities, we have some that exceed 40%, where, a combination of factors has come to play between vaccination pathways we've arranged, healthcare providers have arranged, outreach, trustful messengers, registration support, transportation support. They've come together in a way that we're doing even better than the county average as a whole. In other communities, we have to keep at it. We have to keep building the trust. We have to keep removing the barriers. And each week we're trying different ways to, build that confidence in the safe and effective vaccines we have. Adding a third vaccine that is one dose also removes some barriers. Every approved vaccine, we feel really confidently is making a huge difference. So we're learning every week from each of these targeted experiments from our healthcare provider partners that are reaching these communities, and we'll continue to adapt.
Thank you. I just have one really quick question. I saw also that you guys are beginning to vaccinate inmates. Can you tell me a little bit more about that?
Yeah, Sarita, do you want to take that one?
Yeah, we have been vaccinating eligible inmates, so had already vaccinated inmates who were over the age of 65, but the state's change to include high-risk congregate settings now allows us this week to begin vaccinating the larger group of inmates, looking at those who might be due to be released soon with one pathway and those who might have a longer stay. And we're working very closely with the sheriff, our correctional health team, to figure out the best way to start vaccinating this week.
Okay, Henrietta?
Yes, thanks so much. The last I heard, Santa Clara County is refusing to work with Blue Shield. It says the county officials say that they don't need that layer of interface. And you described what's going on in terms of San Mateo County, but it still seems somewhat confusing. You mentioned tweaking the MOU. What precisely is being tweaked, and what options does the county have?
I think the area that we were most interested in is really our ability to work with our partners and make sure that the vaccine was being allocated in a meaningful way and in a way that we felt would be most beneficial to our communities, because we know our communities. I think that every county is going to have to take a look at it for themselves and see if it fits their needs. This MOU is not with Blue Shield, it's with the state. And we know that we're all in this together and working together. There's, everyone's trying their best to make sure the vaccine gets out. It's just that we feel in the county that the county has unique insight into the entire picture of the county, and that we're in the best position to work with our partners.
So does the county have an option in terms of not operating with Blue Shield?
Well, it's the state that is contracted with Blue Shield, so no, we're going to be working with Blue Shield. That's the state's hired them. But we have no problem working with any partner as long as we get our equitable share the doses that we can put out in a meaningful way in our county. And I think that ultimately we'll get to that point, Henrietta, in this MOU with the state.
Well, will there be an appeal in terms of the state, given some of the underserved communities that haven't been recognized by the state with its distributions of vaccines to LA without regarding some of the needs of those most underserved in San Mateo County?
I mean, I think our legislators in Sacramento have made that very clear that they feel it's very unfair to overlook our communities in this county. And they have laid that case out to the state. We are not waiting for the state to increase doses for vulnerable communities. We're taking it upon ourselves to do it. And we will be in those communities serving them in a meaningful way, because that's what's best for our county right now during this time frame.
Thank you.
Okay, I think that is that's the last question, Miles.
Yeah, there's a few questions remaining in text, but we'll circle back to those with some more detailed answers.
Great, we will get.
Hi. Wait, excuse me, can you hear me?
Yeah, yes, Sarah.
Sorry, my raise hand feature is missing, so I wanted to jump in really quickly. I guess I wanted to clarify some questions that Henrietta was asking when it comes to the relationship with Blue Shield. When it comes to signing that MOU, what is the point of the MOU then? If we're going to be working with them regardless, if they're going to be running distribution, what does that MOU really mean for the county?
Sreeja, do you want to talk more about the MOU?
The purpose of the MOU is to make sure that all counties have a role in the vaccine rollout across the state, and that we have a direct pathway so that vaccine continues to flow to the residents in partnership with Blue Shield.
Does that answer?
So, yeah, so then through the MOU, if it were to be approved, are you hoping then to continue working with Carbon and other vendors?
Yeah, absolutely. We're going to continue to work with our vendors. At least that's certainly our hope, and that's what we need to do in this county to get the vaccine out in a meaningful way.
And then I had a follow-up question in regards to the county's new focus on underserved communities. We know that it's been extremely competitive to get appointments. A lot of it's been done online, so people have been left to the side. How is the county going to ensure that those residents in those underserved communities are the ones that are accessing these clinics and aren't having to compete with the broader Bay Area like many have?
Yeah, I mean, it's really based on our outreach. We're going to do, smaller locations and kind of a door by door, block by block approach to areas that really have, we've seen to be a hotspot for COVID and for vulnerable areas. We're in the process of working out those details and exactly how those sites will be run. But believe me, that's not something that's been lost on us, and it's something that we'll continue to strive to achieve, to make sure that those communities that are vulnerable and most in need get priority.
And I understand that there are communities that we've already identified that have been underserved. Which specifically are you thinking of targeting first?
Well, I mean, I think that you could look through the county, and I don't think that any of these areas are secret, but certainly there's areas in East Palo Alto and Bellhaven and Menlo Park and North Fair Oaks and parts of Redwood City and North Central San Mateo and South San Francisco and Daly City and certainly on the coast. And I think that we have to look at all of those in other areas, but we'll be using some data to approach this in areas where we've seen COVID widespread and some of those other areas that we maybe don't see such a great response to the mass vaccination side. So again, these areas will be very targeted and based on some of the data that we have.
Thank you both. I appreciate it.
Okay, thank you all. Listen, happy St. Patrick's Day. A lot to celebrate, but not too much. The message has to remain for all of us to be cautious and let's see this thing through. We've got a long ways to go still, but we're heading in the right direction. Take care and stay safe.
Thank you.